Today is Monday, August 30th. We're in a routine now where this update comes every Monday, once a week, and I think that's fine for now because there's new data, new information, all at the same time while things also aren't terribly different. So let me start with the numbers. As of early this afternoon, we have 214 patients who have COVID here at the UF Health Shands Hospital. Last Monday I reported 229 or so. So I think we're seeing this slow drop, which is fantastic. Our ICUs are still very busy. So that's something that is certainly putting pressure on so many people. And our pediatric patients today are 14 with 5 in the ICU. Additionally, we have 4 people in labor and delivery. So there's been certainly some subtle changes with our pediatric patients between the last video and this. In fact, we hit our high last week on Thursday of 16 pediatric patients. So things in many ways are getting stable, but in other ways they are still of concern. No question that all of our efforts in our community have been helpful. I think the increased vigilance on distancing, I think the increased awareness of outdoor versus indoor have helped. There's no question that the public push for getting treatment early, like Regeneron, helps people avoid hospitalization. I'm thankful that there's a ton of outside exposure to this. I'm sure all of you know that at UF Health Shands and UF Health, we've offered Regeneron since December. So I am pleased that the outside world is also getting on board, and we need to keep making sure that folks are aware that it's available. Vaccination status, that's been a big part, I think, of getting things to calm down. So we will keep encouraging vaccination. But we're not out of the woods. This morning, the Lake City Medical Center still had 68 COVID patients. Putnam Community Hospital still had 62. The 3 hospitals in Ocala are nearly 300. So around us, we still have communities that are struggling with COVID hospitalizations. And I often get asked, are we concerned about the other counties? The obvious answer is certainly we take patients from other counties, right? So it's something we should be mindful of. But I think there's an important, subtle underlying fact, which is people from other counties work here. People from other counties shop in Gainesville. People from other counties bring their kids to school in Alachua County. But if you look at just the UF Health Shands Hospital, 30% of our workforce lives outside of Alachua County. And so we need to remain mindful of the fact that counties around us are struggling with vaccination status. They're certainly behaving differently when it comes to outdoor versus indoor, to masking. So we still need to pay attention. We still need to have an awareness. We firmly believe still vaccination is important. It's something that will help prevent severe disease. We know from the clinical trials that it does really what it's supposed to do when it comes to getting folks better along the curve. The vaccine was never intended to prevent the infection. And so we will remain encouraging people to do it. And please know that we're creating more and more availability in sites. Please go to the bridge to look where you can get the vaccine. And we're getting questions about the booster. And so we will be sending out information fairly soon about how to get your booster and when to go. So please stay tuned for that. And I know it's been only 2 weeks, but it's been 2 weeks where we've mandated N95s if you've not been vaccinated at UF Health Shands. We will keep encouraging vaccination, but if you're not vaccinated, you will have to remain N95 masked. It is uncomfortable to wear it for 12 hours for those of you that work 12-hour shifts. For those of you working 14, 15, 16 hours. When you have time, go outside. I would still encourage everybody that if you need a little rest from your mask, go outside, walk away from people, and then when you're back in the buildings, we will continue to mask. I remain in awe of how all of you are managing this, because 214 patients is really just under a quarter of the total patients here. It means you're taking care of so many people, and you will take care of more and more people. You have to do the life-saving things you do. I spoke with a faculty member today, in fact, who reminded me, rightfully so, that in our community, in the state of Florida, people may be nervous about going to hospitals, but they shouldn't. If they need medical care, they need to go. And at UF Health, you will continue to take care of so many other people besides COVID patients, because you are the flagship hospital at the flagship medical school at the flagship university of the state of Florida. You all have a bigger obligation, and you fulfill it every day. You're all amazing. Thank you for what you do.